everyone. Welcome to Jital Ask the Expert, our episode. Today we will be talking about how improper shoes can affect your posture, your gait, create a lot of pain in your lower back, and a lot of other balance issues. So today with us we have Dr. Allison Wade. She's board certified in orthopedic surgery, American Board of Orthopedic Surgery, fellowship trained in orthopedic foot and ankle surgery, and owner and operator of Brevard Orthopaedic Specialist. So we will be talking with Dr. Wade today on all sorts of issues that can be caused by improper footwear. My name is Jital Patel. I'm from Coastal Occupational Therapy, and I'm an occupational therapist myself. Dr. Wade, thank you for being with us today. And if you would like to go ahead and tell our audience a little bit about what you do and anything else you want to add on to your incredible list of achievements and credentials.
Well, thanks for having me on the show. I appreciate it. Dr. Allison Wade, I'm foot and ankle orthopedic specialist at Brevard Orthopaedic Specialist. And we are on US 1, corner of NASA, close to the corner of NASA and US 1. And we treat many different orthopedic conditions, some surgically, some non-surgically, and mostly foot and ankle. We also treat other knees, hips, things like that as well, non-surgically. So I'm happy to be here and help answer some questions.
Sure. So, let me ask you, Dr. Wade, as a therapist, we go into people's homes and we're most of the time we're working on a lot of balance, exercises to increase their strength. And one of the biggest things that we see is, we live in Florida, but people are usually barefoot or they're wearing flip-flops or some sort of sandals without any ankle support. And, we work with a lot of the musculature, neuromuscular to work on their posture and also their balance, but not having the proper footwear definitely does not help them achieve the fullest, their 100% potential in regaining that, the limitations. So can you tell us what you see, in terms of, I guess, physiology and all the problems that just improper shoes can affect? We definitely see a posture change, a different gait pattern. But what else do you think that, has an impact when you're not wearing the proper supportive footwear?
So some of the the pathophysiology that we see a lot here are flat foot. So we have a lot of flat foot patients that if they don't have a good arch support, then allows the foot to turn off to the side, which then puts pressure on their ankle. Many tendons will get tight, others will get loose, and then they continue to turn their feet out and their arch down. And then it causes them a feeling of unequal leg lengths. They'll start limping, going into one leg or the other. So we do suggest that if they can remain flexible enough to where they can bring their foot back into a neutral position, which is going to have to be done by external means, bracing, inserts, shoes, that sort of, there's good arch supporting sandals as well. But barefoot, we're not a real fan of barefoot because it allows the foot to go too far off into its flat-footed position when we're talking about the flat foot. So right, the opposite of the flat foot, you have a high arch. The high arch is like a trampoline that's never going to hit the ground. So you have to bring something up to it in the shoe. Whether the shoe has the arch support or you put an extra arch support in the shoe, you have to feel it supporting as you stand. If you think you're standing and you're not feeling that support, or you can run your hand underneath your arch while you're fully standing, then it's not supporting your arch. So you need to feel it coming up to the arch for high arch foot, which has its own alignment issues compared to the flat foot.
Right. Okay. Good to know. So what about clients that have neuropathy? We see a lot of clients that have neuropathy and we're working on balance and strength. And then a lot of times they'll say, well, my balance is off because I can't really feel my feet, or my feet feel like, ton of bricks. Or sometimes they just say it kind of feels like they're walking on clouds and not really have that sensation. Most of the time they prefer walking barefoot around the house because it just feels comfortable. But we know that that's not entirely safe. So any suggestions for people that do have neuropathy? Any tips for them?
I mean, particularly for neuropathy patients, walking barefoot can be dangerous because they won't feel if a sewing needle. I've had sewing needles and seen in X-rays of the feet. There's even glass. There's foreign bodies. They don't feel it going into the foot until it ends up with an infection later. So I
Yikes.
definitely recommend them not doing that if they have full neuropathy. Many just insist that they feel more comfortable without shoes because their shoes feel too tight. So they have to make sure they're not lacing up their shoes too tight. They can skip the middle lace of the shoe so that they don't have too much pressure over the dorsal nerve and the midfoot area. Because when the shoelaces, they'll swell all day because neuropathy will make the foot swell. So they'll swell, they'll push against the shoe, and then that's why they don't like the shoe because by the end of the day, it feels very tight.
What do you see as some of the safety issues of the
But
popular type of shoes is what I mean. What are some of the safety issues of popular types of shoes, say in, flip-flops or high heels, or even those ill-fitting shoes? Because sometimes people wear shoes that are not either too tight or too loose.
I mean, we see a lot of injuries.
Yeah.
High heels, spraining of the ankle, fifth metatarsal fractures are probably the most common fracture of rolling the foot in a high heel. So although we do like to wear them for, weddings and activities, we got to be very sure-footed with them and make sure that you're not going to roll your foot on that. Otherwise, most shoes, flip-flops, some of them don't have really good arch supports, or some of them are too almost rubbery where the foot will stay. And then if you twist, the foot won't come with you. So they'll break their ankle or they'll twist their ankle because the foot didn't follow. If you had a misstep, then the foot will stay with the shoe on the floor, and then the rest of the ankle will rotate around that. I mean, we've seen lots of different injuries of toes being, hitting, being jammed and hitting with the toes. So you want to make sure that your environment, if you're going to wear flip-flops, make sure you're not trying to, saw anything in the rain while holding your flip-flopped foot on the piece of wood. So we have a lot of issues with that. So just make sure your environment is not too slippery. Make sure it's good and supporting your toes, or not around anything that can drop on them. We've had a lot of things that can drop on toes. Frozen turkeys around the holidays are another popular injury to the toes. So just make sure if you're going to be carrying something heavy, probably best to do it with a closed-toed shoe on your foot.
Yep. And what about cushioning? I know there are a lot of shoes that now come with like the shock absorbent type of material, or they have they call it the memory foam shoes. I mean, I've even seen shoes they sell them in Walmart that say memory foam in them. But are they really supportive? Do they really give you the proper arch support and the cushion? Is that something that you would recommend?
I think they give cushion. I don't feel like they give as much arch support. It comes down to the patients and how they feel. If they tell me they feel great in that shoe, well, then that's the shoe for them. But if they're telling me that their arch they feel unstable, then they need to find a different shoe that has, because you can have a good arch support in a sandal and then put a cushioning heel cup if you need the combination of having something soft in your heel but having an arch support. Then you can just combination arch support and lay what's called a visco heel or a cushioning heel cup in the back counter of the shoe.
Great. Thank you, Dr. Wade.
Mhm.
So one last question about this. I think you've given us really good tips and ideas and what not to do and what not to wear. But what are some tips for buying effective footwear? Anything that you would recommend that we should choose one over the other? Not so much brand, but like you said, the arch support, cushioning, and things like material.
I mean, we usually suggest that if shoes can be quite expensive, and we do suggest that, wherever they go get their shoes, that someone can watch them walk and evaluate their gait at the same time, and then they can decide which shoe, whether they need the high arch or whether they need corrective because they're flat arch, which shoe is going to help them the most. So, and then there's the toe box. If you have a bunion or hammer toe, I personally like mesh tennis shoes that have the ability to let the forefoot have some space, because everyone's almost always wider in the forefoot than they are in the hindfoot, and shoes aren't made to accommodate for that. So you can get a quote wide shoe, but it's gonna fall off the back of your heel because it accommodates your toes and your forefoot, but it won't accommodate your hindfoot. So just get a shoe that fits, but then stretch the front of the shoe. Either go to a shoe cobbler or use the little wooden Dutch shoe stretcher, and stretch the front of the shoe. Otherwise, you're going to have a wide shoe that's wide the whole way back, and you'll have trouble keeping your heel in the shoe.
Well, thank you, Dr. Wade. I think
You're welcome.
you shared some really good tips and what not to do. And so as we wrap up today's exploration in the world of footwear and its impact on posture, remember that the shoes that you choose are more than just a fashion statement. They're the foundation of overall well-being. So you want to optimize proper arch support when you're choosing your footwear. So you're not only enhancing your comfort, but you're also promoting better posture and alignment. As an occupational therapist, I encourage you to be mindful of the choices you make when it comes to footwear, because recognizing the role in footwear, it shapes how you move and how you perform your daily tasks. So again, thank you for joining us on today's Jital Ask the Experts. Dr. Wade, thank you so much. And
thank you for having me.
Of course. And I just want to mention also Dr. Wade, Brevard Orthopaedic Specialist, their office. Dr. Wade, can you tell us where your office is located?
It's at 930 South Harbor City Boulevard. So we're close to the corner of US 1 and NASA. Our phone number is 321-345-7579. And we're also, you can follow us on Facebook and Instagram. And see all the things that we do. We have a lot of exciting things that we do here in the clinic to help patients out, and you can also visit us on the website as well.
Awesome. Thank you so much. And everyone, if you found this information valuable, again, for Coastal Occupational Therapy, don't forget to like, share, subscribe for more insights into occupational therapy and daily living. Until next time, take a step in the right direction towards a healthier, more posture-conscious you. Thank you for joining me, Jital, at Coastal Occupational Therapy at our OT Corner.